Today we're talking about orthobiologics. An orthobiologic is a substance that a surgeon or a physician will put into the body to facilitate healing or potentially to facilitate the speed of healing or increase the speed of healing. You might even hear this called regenerative medicine. Now, it's important to remember that these are not things that a PT or a PTA is utilizing. Instead, a patient under our care for a particular injury may have had an orthobiologic utilized in a surgery or may be receiving an orthobiologic. So it's important that we understand how these substances are going to affect our tendons, ligaments, and cartilage. Our first orthobiologic is called Aprotinin. And it's an injection. Aprotinin is a protease inhibitor, and specifically it's inhibiting collagenase and gelatinase. And these two particular things, you notice I've underlined the A's on the end. That means that they are breaking down those substances. So we don't want breakdown of collagen or gelatin. So we think about gelatin as not necessarily a jello mold, but you know how squishy a jello mold is and how it absorbs that shock and kind of rebounds? We want that in a substance such as our meniscus here. So we don't want collagen and gelatin broken down. We want to inhibit it. So Aprotinin might be an appropriate injection. In fact, there's some research to say that repeated injections may be facilitatory towards an improvement at 3 months. Now, we're still undergoing a lot of research on these orthobiologics, so take everything with a grain of salt. Our next one is a type of sclerosing injection. Okay. Now, there's a couple that you might see out there. Prolotherapy you might hear utilized out there. And there's a thought process behind the fact that after someone has particularly a chronic injury, that there's a lot of new intra-tendinous blood flow. And they call this neovascularity. And it's not good. Yes, we need blood to heal. We all know that, but we don't want too much. And this neovascularity is abnormal. So we want to potentially do something to reduce that or to sclerose it. So a vascular sclerosant is going to shrink down or smush down a vein or an artery. So we'll see that prolotherapy uses this hyperosmolar dextrose as their substance of choice, but there are also other substances out there that are going to create this shrinking down of this blood vessel. And we'll see that also, in addition to this, that this is going to increase the proteoglycan expression and increase chondrogenesis. Chondro, what does that remind us of? Chondrocytes. This is good news, right? And then genesis, and genesis means growth. So maybe this might be a very positive thing that we might see utilized out there. PRP, platelet-rich plasma. Now, you can use whole blood or you can use PRP. So platelet-rich plasma basically takes blood from the patient and they centrifuge it down. And they increase, so then they withdraw all of these red blood cells and they withdraw all of the excess stuff and they basically make it a high dose of platelets. And you'd say, well, what's the purpose of this? Well, platelets actually have a bunch of growth factors. So this is a way that we can engineer our tissues or engineer our blood to maybe facilitate healing a little better. Now, some of the growth factors are going to have some really positive effects. So not only do we have cellular factors and humoral factors, but those growth factors are going to induce healing and reduce degeneration. So here are our 6 platelet-derived growth factors that we might say are vital to soft tissue healing, specifically collagen and new blood vessel formation. Now, there are some studies out there that look at that new blood vessel formation and that stimulation of collagen and saying that these growth factors are important. And we've seen that you can utilize PRP in a gel after potentially a surgery, so they can put that gel directly over a graft, or you could potentially inject as well. Okay, so then on to our extracorporal shockwave. So these are treatments where we're going to use excessive sound energy to potentially shock a particular area of the body. And when that shock occurs, it basically rattles all that scar tissue loose to facilitate healing. And we will see this utilized pretty significantly amongst tendons and fascial planes so that we can facilitate healing in a less scarred down type of manner. So this has had some really good outcomes on our plantar fasciitis and potentially our tennis elbows. This is also, incidentally, the same treatment that they're going to use for someone who has a kidney stone. The glyceryl trinitrate patch. So this patch has some benefits potentially related to what we hear glyceryl trinitrate really is. So you can see here that it has glyceryl trinitrate is related to nitrous oxide. And you can see that nitroglycerin or nitrous oxide are related together. We've seen it utilized already for patients who have heart pain, okay, or chest pain, to create vasodilation. Now, we know that vasodilation is good. It brings new blood to an area, and that inhibition of nitrous oxide will lead to reduced wound healing. So the thought process is we take this glyceryl trinitrate patch and we put it on a patient. It's going to facilitate blood flow to the area and facilitate healing by creating some extra nitrous oxide in the area. Now, there may be some relationship to an increased headache risk with this extra vasodilation going on, but nitrous oxide has been shown to stimulate collagen repair and improve the organizational pattern of collagen. So we have some potential there. Again, we need a little bit more research to see exactly how this should be done. Is this an injection or is this a patch? We'll have to continue to research to find out if the patch is actually the ideal way to give this orthobiologic. Gene therapy. Now this is some crazy stuff. Crazy stuff. So gene therapy looks at the fact that we have in our gene matrix potentially things that make us more susceptible to injury. We have potentially some genes that might increase our risk of tendon rupture or might increase our risk of musculoskeletal pathology. And can we either give these genes or give a person who has a defective gene, can we give them a unaffected or a good gene via a virus, an adenovirus or a retrovirus? Can we predict that someone may have an injury based upon their blood type? There's actually research out there to show that the blood type O has an increased risk for tendon injury as compared to A or B blood. So do we already know that someone might be predisposed, and can we then modify that via the virus in order to make sure that a patient heals well? Bone marrow concentrates. So bone marrow concentrates have some really great thought processes behind them. So as the name suggests, a bone marrow concentrate is going to take a patient's bone marrow, and within that bone marrow is a bunch of stem cells. We think that those stem cells can provide the scaffolding for new bone and potentially maybe differentiate into a chondroblast. Chondrocytes, chondroblasts are cartilage makers. Those are great things, right? Especially since we know that cartilage doesn't heal well. Now, this might be an ideal treatment for someone with early osteoarthritis or someone who has an osteochondral defect, because those bone marrow stem cells might not only differentiate, but we'll see that they have some anti-inflammatory processes and maybe will create some angiogenesis and maybe even be a little immunomodulatory. Now, there are some risks with this. There's a lot of joint swelling that can go on with an injection of bone marrow concentrate. And there have been reports of a fair bit of pain in our patients who have this up to 8 weeks after injection. So something to be cautious of or something to be aware of. This is a possibility also to mix with our platelet rich plasma, so with our PRP. And remember, this also is going to depend on the quality of the concentrate. So the patient's sex, particular medications or the graft location could all play a role in how good this bone marrow concentrate that they're pulling from the patient, how good is it actually. Okay, so that's it for orthobiologics. We've talked about some of our cartilage procedures as far as the knee is concerned. So go ahead and take this cartilage quiz on our topics that we've talked about with response to our cartilage in the knee.